This is Dr. P.K. Sahu, Director Interventional Cardiology at Apollo Hospitals, Bhubaneswar. I'd like to give my opinion about the impact of newer lipid-lowering therapies on plaque regression. What we've seen based on the imaging studies, we have seen that plaque regression is very important. Is what we basically treat in our day-to-day practice by doing a coronary angio or by doing an angioplasty is just put a stent and somehow see that the critical blocks are opened up. But it's not just one part of the story, it is the other part of the story being that there is minor plaques which are present all throughout the coronary arteries. And the best way to do it is by putting therapies which can have an impact on plaque regression. One of the most recent therapies have been the PCSK9 inhibitors. Now, what exactly happens when a patient has got acute coronary syndrome? The PCSK9 levels are very high. So it is very mandatory that now the practice should be, as studies have shown, to give a PCSK9 inhibitor as soon as we give antiplatelets or anti-cholesterol medications. Because once we block the PCSK9 receptors, we try to see that the plaque gets stabilized and the patient does not have any future events. This has been a newer form of therapy which has, in fact, is a little bit costlier, but in the long run it has been shown by various studies, especially the OCT studies, which have clearly shown that if PCSK9 inhibitors are used early, either in acute coronary syndrome or even in chronic coronary syndrome, where the LDL levels are high, it has been seen plaque stabilization occurs. Now, what is plaque stabilization? As you must be knowing that it is like what happens exactly is like a volcano getting erupted. So once if we can see that the volcano does not erupt, that the plaque does not get destabilized, then we can prove ourselves that definitely we have done good for the patients. And in my own practice, I have used more than 150 to 200 patients who have put on PCSK9 inhibitors, and the results have been phenomenal because the LDL levels, as per the international guidelines and especially the Lipid Association of India guidelines, is to bring them to as low as less than 40. And most of my patients have been achieving that. Initially, you start with a 2-weekly injection of PCSK9 inhibitors, and then gradually, after 4 to 5 shots, you can give it monthly or fortnight, quarterly as required to keep the LDLs low. In the long run, what happens when you do a complex case, if it is a complex patient where there are multiple risk factors like diabetes, hypertension, very strong family history of coronary artery disease, or has family history of hyperlipidemia, these patients do well, and you save a lot in the long run by giving a good quality of life to the patient and no more features of ACS or MI in the future. So this is a new molecule which definitely has an impact on lipid lowering therapies, not only lipid lowering therapies but also in plaque regression. Thank you very much.